want to welcome everyone today. And I was thinking this morning as I was getting ready to sign in of how important the words that Maureen Howard left us with at the end of the summit that we had on Monday, which we'll be talking more about today. She's been working on this issue, as many of you have, for many years. And I was just thinking so much about the word persistence as a word that characterizes all of us and hopefully will take us into action as we move forward till today. She said, and I don't know if I quoted you just exactly, I did take notes down, Maureen, but said, we will do this work the best we can until we don't need to do it anymore. And to have a name, the Coalition to End Homelessness, with the bold claim that we can actually do this, really requires the kind of persistence that I see represented in the people here. And I want to welcome any of you who are new, who want to join this persistent crew. So one of the things we do at the beginning of a meeting is to invite anybody who's here for the first time or who's been away for a while and would like to let us know that they're back, or someone who may be speaking today, to just briefly say who you are, what group you're connected with, if any group, or whatever else you'd like to just say that connects you to this work. And then we'll move forward from there. So I invite anybody who's new or returning to check in with us and let us know who you are.
You guys hear me?
A little bit louder.
Hello?
Yes.
Hi, how you doing?
Great.
My name is Brian Witten. I work with Catholic Community Services. I've been with the company for about 6 years now. I recently began doing case management work at the stability site back in April. So I'm happy to be here. I'm looking forward to learning some new things and hearing what's going on around the city.
That's wonderful. Now I see Dupre. Is that your name, or did I hear it wrong?
As Dufresne is my first name, Dupree is my middle name.
Dupree, okay. All right. All right, welcome.
Thank you.
Any other new folks here today who maybe were at the summit and thought you'd give us a try?
I'm Jen. I'm from Northwest Integrated Health in Puyallup, and I'm the recovery coach. So I just connect people with resources, and I'm new to all this. I've only been here for 2 months, but I'm just trying to get involved wherever I can to help the clients.
Well, great. Welcome. Really, you'll be a great resource for us.
Awesome.
Good morning. Can you hear me?
Yes.
Oh, hi. This is Sherry. I'm the social work manager at Good Sam Hospital here in Puyallup.
Sherry, very much welcome. We look forward to being able to have a connection with you there. That's great.
Thank you.
Hi, this is Lisa May.
Hi, Lisa.
I'm the social work manager over at TG, Tacoma General with Multicare.
Wonderful. This is a really great connection with the work. So welcome. So.
And for those who can't see chat, there's a reminder from Cynthia Stewart in the chat, just reminding everyone, if you're not currently speaking, if you could mute, it can help knock down the background noise. So thank you.
Well, thank you for your introductions, and it's wonderful to have some new folks working with the medical system. We really do need to have our web, as Maureen described it, grow so that we do cover King County, Pierce County, and wherever else we can cover with the work that we do. So Rob, I'll give it back to you.
Thank you, Rosemary. So the next item on our agenda is our regular standing item to hear what's happening on the streets this week. So Nathan, I don't know if you've been able to line anything up, but I'll let you kind of lead us through just a call for what's happening.
Sure. We always like to have the space just for folks that are doing direct service to report any trends or things that they've seen. I don't have a speaker lined up, but if you're listening and you're on the call and you've noticed any major trends or anything has been kind of happening that you've been seeing, I know the big things we've been talking about are difficulty with getting things through DOL, which still exists. But in addition to that, I know there was some hectic action kind of this week around the idea that we have encampments that are being swept that have like active COVID cases in them, and sort of what we're going to do in regards to that. And I know that that was kind of a shock to the system for some of my other like outreach workers that are on my team, right? That are like, hey, like, you know, what and how and why would we be sweeping people during a pandemic that are, you know, where we know that there's COVID cases in the community, right? Because it does create this big barrier for both like, you know, us as outreach workers and for like the community itself, right? Like how do you even offer resources to them aside from the COVID hotel, right? Because if we know that there's a cluster that has it and you kick them out, like you're not just going to go down and be like, yo, do you want to go to the shelter now? Because like, you know, you're not going to like spread a communicable disease that way. So, you know, I know that there are a lot of discussions happening amongst the other outreachers about how and why we're going to engage with that. So I guess if you're doing direct service work and you have anything you want to say about that or anything else that you're seeing, this would be the space and the time to do so. So I'm going to open it up.
So I'm starting to feel like a direct service worker.
It's because you are.
But I just want to add to the conversation. I don't know if we have anybody from Food Not Bombs on the call today or not, but I did work with them this week and with some of you about a person who tested positive for COVID, and the net result, if you've heard any of the bits and pieces, is that person is at St. Joe's and will remain there for the appropriate length of time unless the person is transferred to the temporary care center. And that activated a number of conversations and concerns about access to the temporary care center, especially directly from the encampments and through people who are not part of the formal homeless response system. And I know that's on the agenda either later today or coming. But the other thing is, you know, if we're going to have these encampments, and it appears that we are, how are we going to make them safe? And I see Jan, and I need to close the loop with you on some things that the street medic idea is moving forward really fast. And a late night conversation. So anyway, thank you to all of those of you who actually leave your computer and your phone and go out. But just to add that in, it's not where I really want to be. So I just want not to screw anything up.
Yeah, let me reach out to you and Jan later too. I know that the street medic thing was being pushed from a couple of different angles, and I'm having some traction with getting some nursing students involved to get out to provide kind of wound care and basic like training on that stuff as well. So let's loop around.
And if anyone else has additional on the streets items, now would be the time to bring them up, or we can move on to the next item on our agenda, which is of course related, and that would be kind of a look back at the Safe Shelter Summit. But here, now's the time if there are any new developments or needs on the street. We also had talked about in the planning group last week, making it a regular thing for people to be able to briefly announce items that they have available that could go out to people. at the tail end of this section. So if you have anything in that vein, this could be an opportunity to announce that as well.
Pierce County released a notice of funding availability at about 6:30 p.m. last night. It is ESG funds, 5.8 million. It includes increasing rapid rehousing, emergency shelter and diversion, increasing permanent housing outcomes from those project sources, increasing street outreach, which is new for the county, and increasing emergency shelter locations specifically and including outside city of Tacoma. So we are looking for new projects, 5.8 million. The notice of funding availability is on our website. So please take a look.
Thank you, Valerie.
So this seems very small in comparison, and is, but I have like 4 really nice new mats, sleeping mats, that I was thinking would be good for somebody who's opening up a temporary shelter. So I'll put my phone number in the chat. If you're interested, give me a call.
Thank you, Teresa. All right, so if we have no additional items for this section of the meeting, let's move on and have a conversation about the Safe Shelter Summit. Can I turn this over to Garrett and Maureen to talk a little bit about the event and where we're at now, and that will lead us to a small group conversation. We want to get some feedback from everyone in the group who attended the summits, either the first or the second one, and also to solicit ideas for how we can move forward with the items that have been committed so far.
How about if I jump in with some statistics, Maureen, and then you can do some more healthy human things? Not that we didn't have this all planned beforehand. So we had exactly 197 people attending our second summit, which is more than we had expected. And when you put the 2 summits together and then you look at all the unique individuals that attended either of the 2 summits or both, that number was 331, which is a lot of people. And interesting, only about 80 people attended both summits. So a lot of people have their summit experience as one or the other. And looking at like the domains from the email addresses that different people registered with, I can get a bit of a window into what groups were there. And so I'm just going to give you kind of the statistics on both summits, but our biggest attendee number set in terms of sheer numbers from one organization was the city of Tacoma, and they had 23 different people attending either or both of the summits, followed by the Pierce County, and then Comprehensive Life Resources. And Lehigh had 12 people at our second summit, which puts them next in the list, and Catholic Community Services. And then interesting, Tacoma Parks had 9 people present for our second summit, putting them high on the list. And then CHI Franciscan, we heard them on the commitment list along with multi-care, and then it's smaller groups. But those were kind of interesting. Some people we haven't seen before, like the city of Fife, had 3 people at the event, and it's kind of fun to see some organizations that haven't had a huge hand in homelessness get involved. And the event went smoothly from the technical side. I'll just cover that so we can get it out. We had another crew of 5 people, so big thanks to everyone that helped with that, which is Rob and Lori and Casey and Teresa, making it safe and keeping stuff flowing in the chat. And just today, you saw an email from Environmental Services. They're expanding their Purple Bag project, and that's, I think, a product of their enthusiasm for this work. But I can't help but think that that us being vocal in support of that didn't have some impact. So I think we'll see things that happened at the summit, but a lot of things are going to be following just like that. So So I'm going to take response. I think the coalition can get an assist on that. Marie, you want to jump in?
Sure, thank you. So a couple of things as we head into these smaller breakout rooms and an opportunity to weigh in. One is that I want to make sure everybody knows that the mayor did call me, and she just was tremendously excited about the summits, was apologetic for having to leave the second one early, and just can't thank the coalition enough. And I thought the fact that the county exec stayed on through the end was really something good, and that he had those explicit commitments. And I know everybody gets frustrated with government, but those are the folks that we have to work with. We have to help them be what we believe they can be and want to be. And so that's just really important. I want to call out Carlos Castañón. I don't know if he's on the call, but I thought he was an elegant facilitator in that he kept the summits going, both of them, but they were not about him. He never made himself the central figure, and that is a real skill in someone who is moderating a group of people with whom they are not even familiar. So I really think that, it was Garrett who first invited him into that role. And so thanks for Garrett for a really excellent suggestion for Carlos. And like I say, if he's not here, oh, he is here. Okay. So anyway, I think that's really very special. That's a gift that Carlos brought to these summits. Moving forward, so I laid out some of that in my closing remarks. And so here's what we have right now as a framework to think about. One is that the steering committees for the winter shelter, the oversight of Kevin, and the summits themselves are one committee now, meeting at 3:00 on Wednesday afternoons. And they are, that's an open committee, and you'll get reminders about, joining us. That's one thing. The other thing is that the work isn't done. One of the things we learned is that a lot of what we were requesting was going to take a lot more time. And even some of the things that were commitments were not able to come forward publicly because of the systems within which they were made. Those systems required, they had a chain of command that required sign-offs on up to the heavens, as near as I can tell on some of them. But so part of it, we're just learning. And the fact that Jan Runbeck was able to get CHI, Franciscan Virginia Mason, and Multicare, to work with the people within those systems so that they could bring forward that commitment that morning is really astounding. And so one of the things that this process, I think, has really brought to the forefront is that within the coalition, we have a number of people who are hopefully looking for a niche where they can use their professional experience, their personal commitment to help us do what we want to do, bring an end to homelessness. Taking these commitments forward and the requests that are not yet filled and the new requests that are continually emerging is, in my mind, it's like it really is a flat kind of system that if you have the passion or you have the opportunity and the interest in a specific piece of this, it's not a hierarchical system. It's, are you willing to work with a group of like-minded and diverse people to seek out the diversity for your group, if that's required, to move these commitments forward to help the parts of the community that we need to respond to our request to be able to do that. And so for some of you, maybe your job allows it. Some of you, maybe you're seeking a meeting to get up in the morning in retirement. Some of you may know somebody who would be the perfect person. And so I think that the summit, for me, the summit's brought us energy and it brought us new players. Certainly we see that from the numbers. If only 82 of us attended both summits and there were 331 total people. So no, we're not doing this in February. There's no decision about when we do another summit, but I just think that as you're in the small groups, don't think about somebody else is going to do something. Think about, what am I going to do? And how am I going to do that? And what do I need to do it? So I want to thank everybody again who came along and agreed that this was a good idea. It was a huge ask on my part for all of you, and it was an amazing experience, both professionally and personally for me, that we were able to do this and do it so well. And somebody said, oh, I think maybe it was the mayor, and she said, you know, I don't know what happened behind the scenes, and I know it was really hard, but to the public, it was seamless and smooth. And so I think that's pretty good. So anyway, thank you, everybody.
Thank you, Maureen, and to Garrett as well for all the hard work on this. So I know Garrett has posted
Wait, 1
a long...
second. Wait, I'm
Yeah.
sorry, Garrett, it's a Wednesday steering committee meeting.
Quality control.
Well, I see that while we're meeting, Garrett's been busy sending information out to the coalition mailing list with the links to the video from the presentation on Monday, the lists of commitments, which I actually put the link to on the PC Homeless website in the chat. And so, you know, I don't know that it would be that effective for one of us to share the list of commitments on the screen. That document is currently 8 pages. But if you get an opportunity as we move into small groups to bring that up on screen so that you can see it, that might help inform some of the conversation that we're going to have in these breakout groups. The purpose of breakout groups this morning, I'm going to break us into groups of 4 or 5 people. We want to hear from those who attended and those who didn't attend the summits to, if you did attend, what were your impressions, what went well, what could be done better, that kind of thing. If you didn't attend, what made it hard for you to be able to attend for that hour? And it could be anything from timing to just, you know, whatever other reason that you couldn't participate in either of the first two summits. The second thing that we want to address in the small groups is how can we best move this work forward? So what we're hoping you can do is at the end of the small groups, we'll break up into small groups for about 20 minutes for conversation. At the end of the small groups, that everyone comes back and puts into the chat where they want to work, which commitments they want to work on, so that we can start connecting the dots and start moving the work forward. We want to make sure that these commitments don't just sit there. So I will post those 2 questions in the groups as we break into small groups, and I'm going to assign everybody randomly. Teresa.
I just want to check to be sure people know that if they have something that will contribute to this work but isn't specifically on the list, we still want to have that in the chat, correct?
Definitely.
Absolutely.
Yeah, what we're trying to do is just get the most good as possible out of this whole experience. The 2 hours that have been shared with that large group of community members, as well as the focused work of the coalition. So if there are no other questions, I will start working on breakout groups. Welcome back, everyone. So as a reminder, hopefully that was good conversation in the breakout rooms and useful. Please, if you did have additional ideas that came up during the conversation, or you want to make a commitment to move items forward, please include that paste that into the chat so that we have a record of it and we can start connecting people to projects. That's the hope out of all of this. Does anybody from those conversations want to highlight anything here in the open room? And feel
Hi,
free
Rob.
to
This
just...
is Keith.
Yeah.
Can you hear me?
I can.
All right. I get to redeem myself from not being able to speak on Monday. We were in a small group, and you know, there were just some general comments I wanted to share. That there was that people were generally really impressed with the organization of the meeting and the commitment of the coalition staff. And really impressed at the weekly report outs. You know, I'll share with you that, you know, when I first started coming to this, 2 hours every Friday seemed like a big ask, and I'm not entirely sure that I'm going to be able to commit to that. But you know, everybody has really great report out stuff, and almost not coming leaves you vulnerable to missing out on some good information. And that we just really appreciated everyone's willingness to come together and to be solution-based and engage in the relationship building that this forum provides.
Thank you, Keith. And it's good to hear not only that the summit was useful, but that you find these meetings useful. So that's great.
Thank you.
Does anyone else have something they'd like to share that came up during their small groups?
So one that came up in our group was, I'm calling it a new request, but how to better serve clients when there are multiple case managers from multiple organizations involved, especially if those clients move from one housing reality to another, or and then the other part of that is how, if there need to be more than one case manager involved with a client, and the case managers have different methodologies, how to help the case managers work together for the client. And it gets more complicated if there are funding stream requirements and all that sort of thing. And so I just thought, a couple of us have been talking for a while about, like, you know, some professional development opportunities for people, and having, you know, different ones of those. And maybe this fits into that umbrella. And maybe that's a way to, you know, we get, especially as new programs come online, sometimes there are some sharp edges that maybe we could skip and get on to serving the client.
Right. Other ideas that came up in the small groups?
Say, Rob?
Yeah.
I think the downside of random assignment was the fact that there were nobody in our group had attended.
Okay.
And that left us with a number of questions we were unable to answer. We did learn about each other's services and that sort of thing in the group, and things along those lines. But unfortunately, we had no point of context for the meetings.
Right. Yeah. Sorry about that, Richard. Do you know, in your conversations, was there any conversation in it, even in your group, about what may have made attending the summit more feasible or possible for you?
Seemed as though it was a very diverse number of reasons.
Yeah. Yeah. Yeah, it's difficult when you schedule a 1 hour, very short meeting, even though there were 2 of them, to be able to pull everyone in who has an actual interest.
The desire was there, that's for sure.
Thanks, Richard.
One
And
of the
maybe
things,
yeah, go
one
ahead,
of-
Cece.
one of the things that came up in our group was at the next summit, having a property owner who already rents to some of our clients to be there to talk about the positives, the negatives, and what they would like to see in the future. And Al brought up a good point that perhaps they could be a part of marketing the other property owners. And then also in the next summit, having someone who's experiencing homelessness present. Because really that's what we're all about, right?
Yeah.
We left the bride out of the event. Or the groom.
Thank you, Cece.
I suggested that we encourage the various organizations and politicians that made commitments to come back once in a while on their own and just report what they're doing to meet the commitment that they're proud of.
That's a great idea. And we can work on reaching out to those who made commitments and see if we can get them back on the agenda for these Friday meetings to report back.
That's what I'm talking about.
Yeah, great.
Well, I put that in the chat, but then somehow it got connected to a link to Matt's article about Well-Found yesterday. And I just want the group to know that as a former Joint Commission surveyor, after I saw that article, I reported it to the Joint Commission. So I don't know whether the Joint will come back and look at Well-Found again or not, but at least they're aware.
Thanks, Al.
One of the suggestions that I had was that perhaps some of the, first of all, it was pretty flawless. And you don't want to increase the length of the meeting, but if you had some surveys that happened during the meeting, it might enable you to gather some information that's going to be helpful for the future.
Thank you. Yeah, that's a great idea. In any of the small groups, was there a conversation about holding additional summits in the future? Sorry, Maureen.
Well, I think there was an assumption that there will be some, at least in my head.
Yeah, there had been conversation among the folks who organized the summit, whether we should do a couple of times a year or quarterly summits, as long as there's enough substance there and work to be done, which there's obviously always enough work to be done. But I was just curious if the larger audience thought that was a good idea.
So,
Yeah,
Rob,
Garrett?
I was going to jump in. I think it would be neat to have large events, but maybe not a summit event. So like I keep thinking about sort of an award ceremony, like the City of Destiny Awards, but something where we can nominate agencies and individuals doing really good work and recognize them, but create that as a platform also to kind of advance the coalition's mission, kind of like how the Academy Awards are to get you to go to movies, right? Like there's nothing else except that kind of driving force behind it. So I would love to think about, all of us to think about, what could we have as a few anchor events each year? Like maybe every year we do, the homeless, like we did in December, the shortest day of the year, the Homeless Memorial Day. Maybe we anchor that with a bit somber message, right? In summer, maybe we do something where we celebrate the people doing the work. Like think about how we could bring people together for different things that continues our kind of core mission.
I definitely see some support for that in the chat. So that's a great idea.
And I think that would be a good opportunity to honor one of the property owners that regularly accepts clients that we place. Because there are certain properties that, you know, have devoted quite a few units to people from coordinated entry.
Yeah, the landlord liaison team gives the fairly regular awards to property partners that go above and beyond in making a way, lowering barriers and opening up units to people from rapid rehousing and from the homeless system. So they're quite aware of who all the best actors are in the property management company and landlords in the community. But they could that could be lit, that information of who's doing that good work could be lifted up even higher.
And it would be great if we know about when those events are, so that some of us at least could show up to support.
Yeah, we used to do them in, we used to do an award in the office of the property partner. Every month we gave the Community Pillar of the Month award, and we've actually even had Executive Dammeier show up a couple of times to some of the bigger ones, but and try to make a little bit of PR about it. But of course, that's all been challenging this last year, so that's an opportunity to reestablish some energy there.
Great,
thank
you.
That's, and speaking of that, lifting up good behavior. I mean, this is just part of leadership. If you want people to do, if there's certain things that you like that people do, and you want them to do more of that good stuff, you need to lift it up and celebrate it. That's how you get more people to do more things that you want them to do, right? And I'm telling you, every time, and I've gone out to every one of these Community Pillar Awards that we've given to landlords, almost every time after we go out, we take the time to go out and give them a little certificate, a piece of paper. Almost invariably, the very next month, they have many more units that they make available to the Landlord Liaison Project, because they tell us, I didn't know what I was doing made a difference. And you guys came over here and gave me this award, and I've never been thanked, you know, for my part in helping the community before. And I'm going to bend over backwards to try to be a better partner and to help out more and to open up more of my units. That has invariably happened every time we have recognized the landlord for their good work. So if we can create a groundswell of lifting up, you know, the good work that anybody is doing at any level, and just creating an atmosphere where everybody wants in to be a part of those who are seen as the heroes, the solution providers, that's one thing we can do.
Yeah.
Thank you, Michael. Maureen.
And following these suggestions, one of the things that I learned when I was in the State Department, a public diplomacy officer, so I was in New South Africa, and every cabinet officer from the US was coming. And so we would focus, we would literally do a program around that particular person, their interests and our interests and the South African government's interests. And we could adapt some of that to what, you know, another piece of this is, are there particular leaders and sectors in the community that we want to help understand either what they're doing, like the landlord liaison that Michael was just talking about, or something that's of high interest to us, and then really focus the pieces that we put forward for them, that it's sort of less arbitrary and more focused, and just as another way to approach it. I can't believe I'm using things I learned there, but anyway. But it really, a lot of it just is relationships, you know, things we don't talk about that many of us do. We just do it. And so maybe if we do some of it in a more thoughtful manner, we can get where we want to go faster.
Great. Well, thank you, everyone. I see Rosemary's hand up.
Just a short thing. In our group, we were talking about the breakdown around garbage. So it's a little more specific, small thing. But in terms of celebrating what people are doing well, I'm thinking it might be important to think about where in the county, the people who are in this tentative time and living in encampments, because the Purple Bag Project is a great commitment, but if it doesn't have pickup related to it, then it's just a celebration of the Purple Bag Project. So I just started thinking about how do we get more positive and consistent behavior from the agencies that are responsible for cleanup and that sort of thing, so we don't lose the energy that people are bringing because it doesn't work out in the end.
Right. Al?
I suggest that a high priority be for this group to invite whoever is involved with the Purple Bag program to come and explain what they've learned from the pilot and what they're going to be doing in the future. Has a pretty high priority because it's one of those stinky issues.
Yeah, thank you. We'll follow up. I know that an email went out to the list today related to that, and so they're open to communicating with us. So appreciate that. So I want to thank everybody for the participation and good thoughts and brainstorming this morning. I'm going to move us along in our agenda. Our next item is we have Heather Moss, who's the director of Pierce County Human Services. We asked Heather to come and share with us a condensed version of a presentation she made before the Pierce County Council, I believe at a committee meeting a couple of weeks ago. And so Heather, I think I've given you permission to go ahead and share materials from your screen, and I'll give you the floor.
Cool. Let me do my pull up my shared screen here for you all. I have a lot open, so it's going to take me a minute here. Hold on.
No problem.
Let's see. Okay, do you see the slide deck there?
Yep.
Awesome. All right, so hi everybody. I'm the Director of Human Services for Pierce County. It's fun to scroll through all of the pages of participants. I see a lot of familiar faces and names, so great to be here with all of you today. This slide deck is about 15 slides. I'm not going to share all of them with you because I don't have all that time, but I will send this on to Rob and he can get it out to folks if you want to peruse in more detail some of the material in here that I'm just going to skip over real quick. The other thing that I would say at the outset of this is you'll note that this was created on January 20th. 9 days ago doesn't seem like that long ago, but a lot has happened since then. This was the day of the inauguration, so actually a few of the Biden administration executive orders have influenced some of the work or some of the thinking that we're doing, so I'll get to that in a minute, but just wanted to point out this is 9 days old already. So this was a presentation that I gave to the Human Services Committee of the Pierce County Council. As you know, 4 of the 7 members of the council are new, so there's a lot of just 101 about human services and those are the parts that I'll probably skip over. Again, you can look at these slides at your leisure at another time. I do want to pause on this slide for just a minute. So for those of you who haven't seen it, this is a copy of our org chart at a pretty high level. The group that you're most used to interacting with is that purple box right in the bottom middle under John Barbie, the Community Services Division. John is responsible for our affordable housing response, homelessness, of course, and community development. So Valerie, who you see on the call with you most every week, reports to John within that box. And then you also see the turquoise box sort of towards the left, the right there of the screen, Sean Dennerline's Veterans Assistance Program. Sean also is on the call today, I see, and is working closely with a lot of our homelessness providers. So that's just to point out where everybody sits within the org chart, but also just to indicate to you, we've got a pretty wide span of responsibility for all things social service related in Pierce County, from aging and disability resources to our small but growing, as you all know, behavioral health division, community action, which is the county version of the CAP program. So MDC is our sister program in that area. And then of course, some of our back office functions, finance administration, and our partnership with WSU Co-op Extension. This slide is one that I'm not going to talk a lot about, but you can look at it later. It gives you a pretty high level overview of all of the divisions of our department and who does what. And then this slide just lays out, and again, many of you already know this, but Human Services is largely guided by, I would say, over 100 different volunteers that serve on various advisory boards, particular to different bodies of work in our department. The newest one on here is the Birth to 25 Advisory Board that the County Council just recently extended for another year. We're hoping that we make enough of an impact in that advisory board to convince them to make that a long-term advisory board. I believe there is so much work that we could do as a county in really supporting our education continuum birth to 25 in Pierce County. So there's that. The 10th one that will be added to this group probably sometime later this year is the Behavioral Health Advisory Board. Again, that is part of the ordinance that the council just passed, along with the approval to pursue the 1/10 of 1%. The 1/10 of 1%, just so you all know, is conditional upon a Medicaid transformation project approval from HCA. So there's a little bit of negotiating happening with that. We expect that to actually take place sometime this spring or early summer. What that means then is that would trigger us alerting the state, and then a few other things have to happen before we start collecting that tax. I don't at this time expect that we're going to see any substantive revenue coming from that tax until at the earliest, the first part of 2022. So we have this year to do a lot of planning. We will be reaching out to many of you to do that, but I just wanted to give you a heads up of general timing on that tax revenue. This is also just a quick overview that I'm not going to spend a lot of time on. Our strategic plan for the department was created a couple of, maybe a year before I got there. So frankly, I'll feel a whole lot of ownership over it. But what I really appreciate about it is that you can see in those boxes there is that it's really focused on community impact and working with our partners and working with the community. And I am here as a testament to that, and our staff from our department. Some of my colleagues are here. I heard Maureen say at the beginning of the meeting that sometimes you all get frustrated working with government, and I get that. I've been on the other side of the table too, and it's probably frustrating all around. And but it's what we have to do, and I think it's also the way that we make this work so effective. So this is where I want to spend a little bit of time with you, because I realize that we have not done a good enough job as the Human Services Department talking about what we fund. And that struck me mostly in the second summit, because when a lot of the partners were making commitments about things that they have done or will do, I realized that the county has actually been involved in many of those, either as a funder or a convener, or a collaborator in some way. So I think we have a responsibility to do more to talk about what our role is and what we've done over the past year and continuing into the future to address homelessness in our communities. So this slide and the next two slides after it give you a quick overview of the CARES Act funding. This is what has consumed a good number of our staff over the last year. Obviously, the pandemic has had a significant impact on everything we do across our community and across our country. But thankfully, we had a sizable chunk of dollars come to Pierce County, about $158 million, that we used to distribute to various needs across the county: economic development, public health and safety, the frontline COVID response around delivering PPE, and then here, community response and resiliency. This is where we dedicated $33 million of that 158 to social services across the county. It fell into a few categories. First, you see here food and nutrition. Oh, and by the way, you can see all of this information and click on these actual boxes on the Open Pierce County website. So it's openpiercecounty.wa.gov, I'm going to guess. Anyway, you can find it on the Pierce County webpage. So food and nutrition, we spent almost $3 million there. A lot of support to food banks, a lot of support to home delivered meals for senior citizens. The big category that you all will be most interested in is our housing stability and homelessness bucket. And here you can see we almost spent $17 million just in the course of around 9 months last year. Those dollars went to sheltering to help our current shelter providers expand their footprint and at the same time allow for socially distanced, physically distanced services in their facilities and to expand their facilities. We also put a bulk of those dollars into rental assistance. Remember too that while we used $9 million of CARES funding for rental assistance, we also received another 10.7, I believe it was, of rental assistance support through the State Department of Commerce. So we put out almost $20 million in rental assistance last year. Keep that number in mind because I'll come back to rental assistance shortly. And also we put some funding into help people staying into their homeowners stay in their homes as well. So we had just over a couple of $1 million in mortgage assistance. Many of our partners who are on this call helped us by receiving some of these funds and putting services out into the community. Like I said, whether that was expanded shelters or outreach or hygiene stations. So we really appreciate your partnership and we're glad to be able to get those dollars out to help people. We're working on a report now to talk about the overall impact of CARES, and what I just learned is that with these $33 million, we reached over 50,000 people, and then the food donations or the food program alone reached over almost 450,000 families in Pierce County. So huge need. We didn't even touch the full need, but we're really proud of the work that we did do. Second slide here about CARES Act funding. You can see the other buckets of services that we provided. In veteran services, Sean and his team did an amazing job getting over $2 million out to our veteran population who needed help with rental assistance, utility payments, car support, gas, groceries, those kinds of things. So we're really proud of the work that they did. We partnered with Elevate Health to get $1.5 million out to our behavioral health community providers. So that was to help them adapt their services so that they can continue the really important work that they were doing to serve clients who were in emergent needs of behavioral health services. So that could have included money to adapt their facilities for socially distanced servicing, or they did a lot of telemedicine. So that was a great partnership there. And then Child and Family Services is one that I'm particularly proud of. I have a background in early learning and know that there's just an ongoing need and a gap in how our not only low income, but really even our moderate income families have a struggle to afford childcare. So we use this as an opportunity to help families pay for childcare who might not qualify for the state childcare subsidy program. So we partnered with Childcare Aware of Washington, and I'm sorry, that's not true. Childcare Resources out of Seattle, King County. They helped us put together a childcare subsidy program that was a big chunk of the dollars here. This is also where we paid for first responder childcare camps. And then some of our partner agencies, Parks and Rec, did some messaging, and we also had supported employment. And then finally, we ran a small program to provide additional support to our domestic and family violence prevention partners, knowing that there was a suspected increase in domestic violence. We're seeing that play out now as people are going back to work and victims are more free to report those incidents. So we're seeing an uptick now in our domestic violence family needs that we were able to support. And then finally, the final category here, just $2.6 million for transportation and other services for disabled populations. A lot of this went to special needs transportation. We helped our senior centers rethink their footprints and how they deliver services. We actually provided funding to, it was either 18 or 21 senior centers across the county. Little grants here and there, but it was dollars that were pretty unrestricted and able to help them think through how, when they do reopen, how they can do that in a safe way for their senior population. So that was our CARES dollars. It was fast and furious, a lot of money going out, a lot of new programs, a lot of new partners that we've never worked with before. So we, of course, learned a lot of lessons. One of the things, and you'll probably be familiar with this concept, the number one there is really, you got to go slow to go fast. And I think in some instances we went too fast and stood up programs that then we had to make a lot of changes to. And some of you on this call were victims of that when we sent out a lot of edits to how we were running different programs. And I apologize for that, but lesson learned, and we're thinking more carefully now about how to implement programs going forward. That being said, none of us have ever been through a pandemic before, so you know, we did a pretty good job, I would have to say. So I'm not going to go through all of these lessons learned, but the other one that I'll point out is number 7. I think for all that we try to get messages out through our engagement with staff, with groups like this, or our website, or public news releases, there's more that we can do to share what we've been doing and how people can access services. It's not easy to work through government, and we need to find a way to make it easier. That's totally incumbent upon us. So a lot of other lessons we learned, but those are 2 that I really think are strong takeaways for us. This is one area that I wanted to spend a little bit of time on with you all today, because for a couple of reasons. One is that the CARES dollars are gone. So that $158 million, we pushed really hard as a county. We got a lot of services out, and we spent those dollars in a lot of good ways. Now we're in 2021. There's a little bit of funding coming in much different ways to us from the federal government. One example is the rental assistance program that's starting up again soon. But we're not going to get another CARES allocation. At least I'm not hearing of any plans around that. The dollars now are much more prescriptive to different specific focus areas and have much more requirement around them. So we'll be working within those requirements to think about how to get these dollars out. So let me see if I can. This is kind of hiding the top of my slide, but I think it's the number up there is like $26 million that we've received from other sources in addition to the CARES dollars. Of those, about all of them, but about $8.5 million we've spent or allocated so far. A couple that I want to draw your attention to are towards the bottom, you can see the state $4.7 million for shelter expansion. I believe Valerie and others have talked to you about this before. This was the partnership that we had with 4 other jurisdictions, Puyallup and City of Tacoma being 2 of them. I think it was Lakewood and maybe Gig Harbor were the others. No, that's not right. Lakewood and somebody else. Valerie's saying it, she's shouting. Thank you, Valerie. University Place. This was really cool because it allowed us to come together as regional government and think about how to provide shelter in a different way. So one of the things that we just talked about in the small group I was on in this call is that some of our jurisdictions have historically been more reluctant to take on some acknowledgement about their role in responding to homelessness, and it's largely fallen to Tacoma and the county. We have seen through this pandemic other jurisdictions stepping up and thinking about what their role could be. In fact, part of that $4.7 million is funding a small shelter project in Puyallup. For those of you who know Puyallup, that's kind of a big deal. It's also helping to pay for the tiny homes that the City of Tacoma is putting up at 6th and Orchard. Again, kind of a big deal because it's really moving shelter out of the urban core. So we're really pleased with the partnership and just the creativity that some of the jurisdictions are using to think about those dollars. You can also see in this list, going up a couple of bullets there, the $10.7 million that I referenced earlier about emergency rental assistance. And then ESG, Valerie just told you about that today. That $5+ million is out in ANOFA. I want to urge all of you who are providers to take a close look at that notice of funding availability. We are putting those dollars out there with not a lot of expectation in terms of what we want as priorities, because we know that you are closer to the work and you can see what the needs are and you can see how our world has changed in response to COVID. So I'm really hopeful to hear good ideas about how to use those dollars to respond to homelessness in 2021 and 2022. So again, I'm just going to underscore Valerie's request that you take a look at that, and I saw that she posted it in the chat message. We also have other dollars that we anticipate coming to us, CDBG and energy assistance, again, very prescriptive to specific responses. So we are working hard to get those dollars out into the community. And I know we have to do more to share where those dollars are going and to what end. Just real quickly, and then I'll be done. Rental assistance. We have, like I said, new dollars coming from the federal government to run a 2.0 rental assistance in 2021. Actually, the NOFA for that is out as well. We are hoping to get a handful of providers to continue the good work that many of them did with us and for us in 2020. The big news here is that although we know we've received $20 million directly from the federal government, or we are about to, the city of Tacoma is also directly being awarded $6 million. We have heard that there are additional dollars, as much as $25 million potentially coming to us again through the state. So federal dollars to the state and then to the county. That's a big chunk of dollars to put out. We've done some projections. We know the need is there for rental assistance, particularly as this pandemic stretches on. But it's a heavy lift for us and for our provider community. So we are hopeful about getting some partners into that work. I know Lori's on the call. She was in my small group. We're also working with Tacoma Pro Bono and the Center for Dispute Resolution, along with Pierce County Superior Court, thinking about how do we build on and expand the eviction prevention or eviction mitigation program that they've stood up as a pilot program. So lots of great work happening around rental assistance. We hope to have that program up and running by early March, well in advance of when the governor's moratorium on evictions ends at the end of the month, or expires at the end of the month. And then, oh, I'm sorry, I lied. One more thing, FEMA funds. So again, I want to remind you, I built this slide deck in preparation for a presentation on January 20th, the inauguration day. At that point in time, knowing what we knew, the county had and continues to have a pretty conservative approach to how we use FEMA dollars. That is still true. But given a couple of the new directions that are happening under the Biden administration, we are going to take another look at FEMA funding as a potential source of revenue for expanding shelter for the next few months. I'm not going to promise anything. And, you know, for all of the comments that I see on social media and in emails and with your group and with others, FEMA is not a slam dunk. It's no small feat to get FEMA dollars and to do all of the things that you need to have in place to get FEMA dollars. So I have a list of, you know, a couple pages long of all of the things we need to do to make this happen and see if it's feasible. And we're going to do that work and we'll go from there. I'll give you an update once we make that determination, but I just wanted you to know that that we are considering FEMA as a source for serving the at-risk population, and that's different than what we've traditionally done in Pierce County, and that's why you see some other jurisdictions using FEMA dollars or anticipating to use FEMA dollars for housing their homeless population. So more to come on that. I'm not going to share that with you now, but I think that's all I have for you at this point. I'm going to stop sharing, and if there's time, Rob, I am available for questions, and I'll send you this slide deck shortly.
Yeah, that would be fantastic. And I will open the floor if folks have questions. Any questions, feel free to raise your hand or just speak up in the group.
Thanks, Jan.
Teresa.
I just have, it's not a question, it's a comment. I just appreciate, Heather, that you brought this out and made such clarity about how your operation works. I've never seen this done as clearly. So I'm getting a lot of feedback. I wonder if somebody has their mute off or something. Anyway, so I do want to say, good presentation. It's nice to see something that's so fresh and so complete about this. And even though we're not always happy with the decisions that get made about funding, we do recognize that there's a lot that goes into making those decisions. And we do appreciate all of you who work on that.
Thanks, Teresa. And I really do want to underscore, I see the need for us to be sharing more information like this on a regular basis with our partners and providers and stakeholders.
Carolyn?
I don't see the little hand, you know, down in the bottom. So sorry. Heather, I just, you know, I'd like to talk to you or somebody on your staff offline, because at the summit, you know, we committed to continuing to ask the county to approve the revenue for housing tax. But I'd like to get a little more background to see what we're up against, because we're not getting a lot of warm and fuzzies. Is there a way I can email you or somebody on your staff?
Sure, I'll put my email in the chat box so you can pick that up there, Carolyn. And I would just say that, you know, that we have a very, like I said, new council, mostly 4 out of the 7. It's Democratic led now. 4 of the 7 are Democrats. That probably leads a little more opportunity, but you need 5 votes to do that. And they just passed the mental health tax. It took them 15 years to pass the mental health tax for a lot of valid reasons. And we finally got there. And there's a lot of work to do to push that through. I would just say, do what you need to do, but expect that it's going to be a long road.
Well, I was hoping for 15 days instead of 15 years. All right, I will, I got your email. I asked for it already, and I'll send you a note.
Heather,
Any other questions? Yeah, Al.
Heather, let's go back to the accountable care organization model. I know you said there's negotiations. How receptive is the state and the feds appearing to be at this point?
I am not a part of those conversations. What I'm hearing is that there is still a lot of interest in our county by a lot of our mental health and behavioral health providers to do something different. The Healthcare Authority is not super receptive, but also know that they have to listen to their provider community in Pierce County. So that's why I think there's negotiations going on. I'm not a part of them. We're just sitting back and waiting patiently, but I hear that we will come to an agreement. Everybody that I've talked to thinks that we're close to an agreement.
All right, any last questions? I see Maureen's hand up.
Heather, thanks. That was really a wonderfully clear, readable, understandable presentation for somebody who's not in government. So thank you. But one of the things that I realized when I was looking at the org chart, the number of different boxes, if you will. And one of the things that's happened with the city recently is that it's not just NCS, which handles homelessness, with whom we interact, but environmental services now and planning, because that's where a lot of the housing action is going. And I'm looking at your boxes and wondering if we're missing opportunities as a coalition where there might be relationships at a minimum, resources at the maximum, or ways in which we can enhance the work that these different boxes are trying to do and be supportive or whatever. But I'm thinking especially of the CAP agency part, but also you got a ton of people in aging and I want to say long-term care, but that's not right. But in that box, and you know, if we look at the community of people experiencing homelessness and the high levels of people with disabilities, anyway, that's another request on the request list.
Yeah, my first response, of course, Maureen, is you're killing me. Seriously, you want to be more in my business? But you make a good point that our community action program is where we have a lot of services to provide services to our most vulnerable families, those probably at risk of homelessness. So while they might not be out on the streets per se, they are unstably housed. And so I think there's a strong connection there. Also, I know that our Planning and Public Works Office is really taking the lead on the abatement program and encampment response, along with our Sheriff's Department. We work closely with them. That's all on hold at this point in time, but at some point that's a group that we engage more actively with in recent years, in the last couple of years. So yeah, there's tendrils out into county government that we can certainly help facilitate reluctantly.
Happily.
Your comment about you're killing me led to my last question, and I promise. Are you getting enough sleep?
I have the most amazing, I work with the most amazing team of people. Valerie's the one that you need to worry about. She took on yeoman's work in the last year, Valerie and Sean both, who are on this call. I just sit back and watch them do amazing things. So yeah, I sleep pretty good. Thanks.
Well, thank you very much, Heather, for taking the time to talk with the coalition this morning and pointing out ways that we can coordinate our work and be supportive for the county as well. So thank you.
Happy to join you. Thanks for the opportunity.
All right. So the next item on our agenda is a change. We were going to talk about the temporary care center with Greg Bickford, who is the director of that temporary care center. Greg let Garrett and I know late yesterday afternoon that he had another meeting come up that was in conflict, so he couldn't join us today. But we had a particular, we've had a number of situations, and we've talked about the temporary care center a number of times on the coalition calls. And I know between Garrett and Maureen and I, we thought it might be a worthwhile exercise to spend some time this morning talking about kind of walking through a scenario. If we had a situation where someone tests positive and we need to get them, we being the shelter providers or members of the coalition, needed to coordinate getting them to a safe place to quarantine, what would be the best way to do that? So Maureen, Garrett, do you want to get us started?
Well, I'll start, Garrett. So again, I'm outside of the provider system. So what providers are experiencing, I only know secondhand, but I know firsthand from trying to get a woman who on a Sunday who said she couldn't get into shelter because she was running a fever. She had a child, and it took about 45 minutes, starting with a number Garrett gave me, to make my way to Multicare's access for the treatment care center, and only to be ended at that point because it needed to be a conversation between the woman and the Multicare person, which was totally appropriate. And I did not follow that up to see if the woman got in or not, but it was incredibly frustrating just to do the part that I did. And then the other night, I think Irene is still on the call, Food Not Bombs, I got a text from them about 7:30. They had a COVID positive person they had taken, a person they had taken to the ER at St. Joe's. Person was COVID positive. The hospital wanted to release the person back to the streets. What could they do? And that was kind of like, I was done. And we need a better process. We need, not only the individuals who test positive, who have no place to live, cannot go back to the streets. That is not acceptable. They will not be allowed into a congregate shelter. They put the shelter at risk, and they have to have a place to go. And then there's the whole, on the encampment side, there's the whole issue of if somebody is positive, test positive in an encampment, then my assumption is we probably have more positive test results in that encampment, not just among the people who are there now, but who have been there, who may have relocated into a congregate shelter within the time frame that's used, the people who may be doing outreach, whether they are volunteer self-help groups like Food Not Bombs and the mutual self-help people, or if they are the professional staff from CLR or TRM or anywhere else. And we're 10 months into this, and we've got no vaccination plan yet for getting everybody who is living unsheltered vaccinated. And how are we going? I mean, this is just wrong.
I see Jan has her hand up.
To address the vaccination plan, the health department has been in touch with some of our direct service providers, and I gave the health department everybody's contact information. I gave a quick lecture on the definition of homelessness, sheltered versus unsheltered. Where the sheltered are, sheltered now is in congregate setting and in hotels with the voucher system. Unsheltered would be encampment, car campers, and individual folks living under porches and in alleys. So that being said, the further away a person is from a congregate setting or a sheltered setting, the harder they are to reach. So I gave the health department team who's in charge of reaching folks with a plan, every agency that I know about that does, see the PATH teams, their direct number. She also shows up at the shelter management meeting, which is Tuesday afternoon. So if anybody has any questions about how to be included on the planning, you are included on the planning, but if you want to know directly from the health department, you don't get an answer, email me or call me, and I'll text somebody from the inside. Okay, the thing that happened yesterday, the good news by the end of the day is that I was given permission from the head social worker at CHI emergency rooms. Okay, so the hospital systems are also another very sophisticated setting. You go to the emergency room, which means you're in the emergency room. You're not admitted to the floor. There are, realistically, we provide care in these different settings. The staff with the emergency room clients is not the same staff once they're admitted to the floor. In the emergency room, you can have perhaps a doctor that doesn't know about the services that are available, yet the client isn't sick enough to be admitted to the floor. They could be treated and then released. So there's unless there's an advocate for that person, and it's hard to be an advocate in this day because the hospitals don't want any more bodies in their environments because of COVID pandemic and the fear of spread. So unless that person can speak for themselves about the situation that they're going back to, or there is an advocate there, and the case manager in the ER isn't necessarily aware of what's going on, and nobody else in the staff would be necessarily aware. So we did have a case of advocacy yesterday. It was Food Not Bombs. It ended up working. I've got the phone number that I can share with professionals who will be guarded in how they use this phone number, but that's not the answer either, right? I mean, it is you contacting me, contacting this one person. So we are working on these systems, and I give Keith Keith Helka, who's here today, a ton of credit for being in the middle of a lot of folks after the fact. But this, to me, this is a symptom of COVID, of poverty meeting pandemic. We have one incident where all of a sudden there's a lot of attention, lots and lots and lots of us get excited. We could have prevented that, right? So my big takeaway from yesterday is hopefully we're working together now. And I know Keith has done a good job of now bringing in multi-care. We can work together to not have to call everybody up and down every single chain to get one person taken care of. So with that, does anybody want to add a comment about yesterday or an improved system of getting folks to the TCC? I know the TCC has been highly frustrating, and I don't think that Mike Boyster is here from the Eastside Community Center, but that was a horrifically sad Christmas week story. So anybody else want to jump in? I see Irene.
Yeah, I see Irene and Nathan with their hands up. And then I'm pretty sure that Garrett is going to want to weigh in. I do want to add, just as background, that we have reached out to try to get the folks who currently run the temporary care center to come speak with the coalition at a future meeting. That date has not been set yet, but I'm hoping that is sooner rather than later so that we can work on a better system. But with that being said, why don't I go to Irene, had her hand up first.
Thanks. I just wanted to say, I really appreciate Maureen's assistance and anyone else who was involved that I don't know in advocating for this person. It's definitely not the first time that we've taken someone to the hospital, and we're volunteers who have jobs. Like, it's really draining us to try to keep maintaining this. I'm skipping a work meeting right now to be here, so it's I really appreciate all your help, but that camp is still being swept, and we thought it was going to be swept today. Turns out they're waiting until Tuesday for some reason. I mean, I think some of you might know why, but Erica Escueda doesn't really like to answer emails from Food Not Bombs. So I'm not really seeing a good solution here that doesn't involve the people who are at those camps, who are, a lot of them are going to deny services because of the problems with shelter that you all know. And they're going to go to other bridge camps nearby, and they're going to spread COVID. And it's just, I mean, this has already been happening, but this is just going to make it worse. Oh, and also I want to add that generally the way this person was treated at the hospital is par for the course, in terms of he wasn't even allowed to take a shower, and he needs surgery on his hand. Like, it's really disheartening to see the way that these people are treated.
Thanks, Irene. Nathan?
Yeah, I mean, I think Irene hit all the right points there. The experience of going into a hospital for a homeless person is really deeply shitty. And I think that the temporary care facility, or whatever they call the COVID hotel, right? Like, I don't know if you've ever tried to get anyone in there, but it took the sum totality of my leadership, maybe 12 hours of continuous contact with the health department to try to get openings there when we had a similar situation. And when our folks got there, the level of treatment they received would be subpar for like pretty much anywhere I'd ever put anyone in my experience doing direct service. Like, I mean, they were basically threatened by the staff as a collective, that if one of them acted up, that they would all be removed, right? I mean, you're dealing with people that are chronically homeless, like there are serious issues at play. So if the one resource that we have, right, won't fit people that are dealing with mental health issues, won't deal with people that are dealing with substance abuse issues, then we don't have a resource, right? So like, it's tough not to be upset about all this, right? And I think that, like, like this is obviously happening. It's obviously happening right now, and it is emergent. And we do need the city to step up and the county to step up to respond to it a little bit more. And I don't want this to get missed. And I know it's a bit of a sidetrack, but this conversation about information not passing cleanly from the city to service providers, to community advocates, to everyone involved with providing service to people in places that are getting swept, like it's consistent. And it's obviously like, I don't know, I don't believe that there are broken systems. I think systems exist and they function in a way that benefits someone, right? So if we can't get clear communication about what's happening, like what are we gonna realistically be able to do? That's it.
Thanks, Nathan. And Valerie, I know you had your hand up.
So as of yesterday, I have been tasked with coming up with a solution and figuring out a non-TCC alternative to folks experiencing homelessness. I started with the health department, figuring out where their gaps are, what are their concerns, what's some funding availability. I sent an email out to all of the shelter providers. And so I just need the data. So how the health department works is if I have the data, I can create a solution, right? So there's a lot of fund sources involved, a lot of things. So if you're a shelter provider, or if you didn't get my email, let me know. But that was added to my list at 4 p.m. yesterday. So we've made some improvements just since then. So but here's the situation. I can't go to the health department and to the Department of Emergency Management and say it's a problem. I have to say this person, and this person experienced the issue. Here's the issue, whether they were declined entry or forced to leave early. So that's the Excel I sent out. I know it's tedious. I know it's a pain in the ass. I still need everybody to do it because then we can create a solution. The next step is going to be for me to go to the service providers and say, what would the ideal situation look like? Where should it be located? And who's going to provide the services? Then from there, we start looking at funding. So just so you know, it's all being talked about. It's very well aware. I was in 6 meetings about it just yesterday. And as of 4 p.m., that is my job now, along with all the other things. So give me those lists. If you're outreach and you've had that experience, send me a list. I'll shoot you the Excel I created. It's not beautiful, but it works. And if anybody else wants to be involved, let me know. But we actually have to have the specific name. So please, and I will do my very best to work with y'all to create a solution.
Clarification.
Thanks, Valerie.
Just a point of clarification, Valerie. For COVID positive people who are homeless.
COVID positive, exposed, needing to isolate and quarantine, can't go into like, I'm gonna ask for the world.
Okay.
And
good.
then we will get Texas, right? Like, but we're gonna start with the world.
Okay. So that picks up the encampments.
Yes.
Absolutely. Thank you. Yay.
But there's a qualifier there, and that's what we've run into. Yes, all COVID positive who are either asymptomatic or low symptoms and don't need hospitalization and have no other safe place to be, qualify to go into the TCC. However, if there is a history of behavioral mental health, that has sent out of the door at least 2, if not 3 people of stories that I know. So qualifications to get in, yes, COVID, either exposed to a known case of COVID positive or COVID positive themselves, asymptomatic and not needing hospitalization. One of our problems with this group is the behavioral health issues, which then denies them access.
Right, which I need to know those because that's the system we'll create based on what the homeless shelter providers, Vallejo did one downtown Tacoma already at the beginning of COVID. It really feels like Groundhog Day, March 2020, doesn't it, right? Like we've already had these conversations. We actually set up the system twice. What do we need to do to replicate those systems? And what happened in the meeting yesterday was we set up 2 sites and almost no one used them. So I need to have then the data to back up. Yes, you set up those 2 sites. The need has since changed. The limitations have now grown, and this is the system we need today moving forward permanently. So this system, the one we're talking about creating, won't have the substance use issues, won't have the barriers for behavioral health, won't have any of those things. And I'm in a constant email with Luis from Tacoma Rescue Mission because he is a big advocate for what this looks like and how it works, and that he was visiting his folks. They were providing case management. So we have to create the system and then we can stick them in where we need it, and versus the other way around. So then our folks, your folks, won't go to the TCC unless they choose to. Everyone has the option to, but then they will have an option that is directly and designed for them to meet their needs.
Thank you.
Yeah, thank you, Valerie. I think this will, hopefully we can recreate the wheel again. So again, we do hope to get the folks from the current temporary care center to come join us. You'll see that on an agenda if it comes forward. Just know that Garrett and I have been working on that. And I do know we're running short on time for today's meeting. I don't want to cut this conversation short by any means. So if there is another critical item we need to talk about on this before we move on the agenda, please say so now. Yeah, Garrett.
I just wanted to say we are writing a letter requesting apparently exactly what Valerie's doing. And so that's in draft stage, and we are still going to submit it so that we can get hopefully a formal response. And Valerie, let's make sure people experiencing homelessness are part of that conversation. And let's make sure it's as easy to go to the emergency room, right? Easy as to go to this temporary care center as it is to go to the emergency room, right? Do you know how I get to the emergency room? 9 different ways, right? I call 911, I get driven there, I stumble in there, right? And I get there right away. And so that should really be our objective, right? Stupid easy to get in. So thanks. And if you guys have any interest in, I'm gonna get that letter out today. Anyone that wants any say in it, it's really just bringing together all of the stories that that everybody that was a provider was afraid to say because they were worried about retaliation from different agencies we work with. They weren't really worried about that. I'm putting words in their mouth, but I was worried about that. And so the coalition was taking that on. So I'm glad to see that all of those concerns can come out in the open without having to worry so much about it being taken as being a bad partner by publicly identifying areas we can improve. Thanks.
Thanks, Garrett. Al, I saw your hand up.
Garrett, when you write this letter, you might want to ask the organization what specific behaviors by people who happen to have a behavioral health diagnosis render them ineligible for admission. The diagnosis per se, it should not, or it's discrimination. So try to pinpoint them on behaviors.
Yeah, it's kind of a nasty letter. I definitely identify that I believe they're breaking the law.
I can attest to it. All right. So as I mentioned, we are rapidly running out of time. I do know, I did want to give an opportunity for the representatives from the Tacoma Pierce County Health Department to offer any updates that would be critical to the coalition today.
Hi, everybody. Yeah, sure. My name's Rihanna Betancourt, and I'm on the community engagement team for vaccine education. So trying to ensure equitable access to vaccine education. I just wanted to say that I appreciate this conversation, and that when Michael Petoniak is on the call as well, he's a team member, and we attended here on the 15th when all this discussion around the TCC was happening, and identified some of the health equity issues around people not being able to get into the TCC, and us not knowing at that time that we were not in charge of the TCC anymore, that it was multi-care. So we took those and sent those issues up the chain. So hopefully that helped any conversations that were already happening, or maybe prompted some new ones. So just really quick, Michael and I's role is to help ensure equitable access to vaccine education. So that could come in the form of a virtual presentation around the vaccine, flyers, virtual or physical, to be distributed in multiple languages, or other resources and updates around the vaccine. So if you are interested in any of that education, you can reach out to Michael or I. We've been reaching out to different housing organizations offering this. Also, sorry, I'm looking at my notes. We know that Valerie is working with one of our vaccine team members, Jenny Shopey. She will be talking vaccines at the February 2nd Emergency Shelter weekly meeting. So if you are interested in hearing about and giving input on the how of the planning around your clients and things like that, please attend that meeting. And I don't think that I have any other updates. I'll share my contact info in the chat box if anybody has any questions.
Brianna, that shelter meeting is a good place to talk to shelter providers, but not a good place to talk to outreach workers. So I think creating a opportunity for the outreach workers, whether it's here or at a separate meeting that you host, that you invite those folks, would really be, I think it'd really be beneficial.
Yeah.
The shelter providers, except maybe TRM, they don't really know as much about the encampments.
We had an outreach meeting yesterday with the vaccination.
Yeah, Jenny's going to be
That happened last night.
connecting with the coalition and setting up a presentation in the near future.
Thank you, Rihanna. So we have a grand total of 2 minutes left in our allotted time for today's meeting. I do know that Colin DeForest is in another meeting and was not able to provide a quick update on safe parking. The other item that we had on the agenda for today was an advocacy update. Maureen, is there anything quick you need to share, or do you want to send out an email?
I've sent an email about the state, basically, but so here's the important thing. The economic impact payments, the stimulus checks are out. If your clients did not have a bank account where there was a direct deposit, mine came as a debit card, as a preloaded debit card. Number one, do not let them throw the envelope away. It looks like a fake government envelope. It is not fake. It's anyway, so do not let them throw it away. Number two, that card has to be activated, and there's a phone number where you will probably have to call more than once because the line will not be available. Number three, they need to be able to read the card number, and it's difficult to read if you've got any visual impairment at all. And number four, here's the goodie. They've got to have the last 6 digits of their social security number. I didn't even know mine, all right? I think in the whole thing or in 4, the last 4, right? Nope, it's the last 6. So the first time I entered 7, so they wouldn't take it. So I had to start all over from scratch, all right? So that's one thing. You got to save the envelope, activate the card following the directions, turn the piece of paper over to see where you can use the card for free. And if you don't use it within the MoneyNet system, the fees for every single use. And the next time, because it's very likely there will be another stimulus check coming, get them an account. Teresa is still ready and willing to help people get online accounts through Seattle Credit Union as long as they don't have bank fraud or wire fraud, okay? And I'll repost the FAQs on the credit union accounts, but that's it. Don't throw away the envelope, even though it looks like trash. It isn't. Write down those numbers so that you can enter them when you need to. They've got to have a phone or they've got to have a computer. They've got to have something electronic. And then make sure they've got the last 6 of their social security number. Make sure they understand the fee structure for using the card. Everything else I'll just send by email. So thanks, everybody.
Thank you, Maureen. And I want to respect everybody's time. I know that we are now at 11:01, so if you need to go, we definitely understand. There will be a group of us hanging out to schedule the agenda for next week's meeting after this, so you're free to hang on. And otherwise, I wish everybody a happy weekend and stay safe.